Thank you for joining us here on the KAMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live now for this breaking news.
Authority, Texas State University Health Sciences Center, and City Manager Jared Miller. We're going to turn it over to our panel real quick for some brief statements, and then we will take questions from our media members. This time, let me go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. Well, we're reopening. We've been doing that now for a couple of weeks, and we're watching our numbers. Our hospital capacity over the last few days is really starting to look much better. And so I think what that means for you and I as citizens is that we're learning how to do the COVID-19 world. I just want to continue to caution us as we do start moving around more and more businesses are opening and we go back to the things that we've missed and the life that we want to be living. I want to caution us just to be careful. Consider wearing a mask. It keeps me safe, it keeps you safe, and it keeps those that we're encountering safe. I want to encourage you to continue to social distance. I know it feels awkward in our society and our culture, but if you keep that 6 to 8 feet distance, then that keeps us from spreading the virus between each other. It'll be tempting because this is Memorial Day weekend as we all get together, and maybe you're starting to do that more, having people over to cook out or doing extended family get-togethers. It's so tempting to reach out and give someone a hug or just to go back to those normal social interactions. I just want to speak a word of caution, and I want to ask for your help. The way we keep ourselves and our city safe comes right down to you and I and the choices that we make as individuals. Wear a mask, wash our hands, be socially distant. Considering others is as much considering ourselves when we make those decisions. And then I just want to personally say thank you to every veteran that lives in our city, to everyone that has been willing to take a stand, to fight for our freedoms, and to fight for the values and the values that we have as Americans. So thank you to our veterans, and I hope each and every one of you has a safe and family-filled Memorial Day weekend.
Thank you, Mayor. This time we want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Good morning. As of yesterday, there were a total of 2,831 cases of COVID-19 reported in Potter and Randall counties, 2,202 in Potter County, and 629 in Randall County. We have a total of 584 recoveries and a total of 31 deaths reported in Potter and Randall counties. That leaves us with 2,216 active cases of COVID-19. I want to take a moment and talk about recoveries. Amarillo Public Health considers several factors when looking at an individual patient recovery. First, a minimum of 14 days must pass from when that person was tested. And the patient must be symptom-free for 3 consecutive days at the end of that 14 days. If the patient's symptoms do not resolve until later, they may go past the 14-day minimum. Patients who require hospitalization may also go beyond the 14-day minimum as they can be sicker for longer. We're also glad that the majority of patients don't require hospitalization. Many patients are kind of within that 14-day window, but we do have a number of patients who require an additional few days until they're considered a recovery. Amarillo Public Health and Amarillo Fire Department continue to work together along with nursing facilities to comply with the governor's order to test all residents and staff of nursing homes. Once these results begin to come in, we anticipate another bump in our numbers as we're testing a large group of people. This information will be helpful to nursing homes so they can coordinate the care of the individuals who live in their facilities. The test results will appear on our report card, just like all of the other test results that we have had reported to public health. And as a reminder, the teams at Amarillo Public Health and Amarillo Public Communications will publish a COVID report card and update the dashboard on Saturday, Sunday, and Monday. Due to the Remembrance holiday, Memorial Day, there will not be a report card on Sunday or Monday. And the dashboard will also not be updated. Tuesday, there will be an updated report card and an update to the dashboard. So we appreciate, again, all of our veterans and the hard work that they have, that they've put in serving our country. Thank you, Dave.
Thank you, Casey. This time we want to go to Dr. Scott Milton, Texas Tech University Health Sciences Center.
Yes, good morning. A couple of subjects. First of all, remdesivir, that's the drug that has been allocated for the use of COVID-19 and has some benefit in some clinical studies. We did receive more remdesivir 2 days ago, and at Northwest Texas Hospital, we have administered this now to 6 patients. In terms of hospital capacity, the most recent numbers I have are from Northwest from today and from BSA from yesterday, and I could just run through those. Overall, we're seeing a continued decrease in COVID patients in the hospitals. There are 22 total patients at Northwest Texas with COVID, only 5 on the ventilator, which is continuing to come down on a regular basis, 9 in the ICU, 13 in the non-ICU beds, 3 patients under investigation. The ventilator usage is 23%, which is decreasing, and the ICU use is 58%. At BSA yesterday, there were 24 total patients with 7 on the ventilator, 13 in the ICU, and 11 in non-ICU beds. There were 2 patients under investigation. Ventilator use was at 54%. ICU and MICU use was about 81%, and these numbers are steady to decreasing as well. So overall, these are good trends, and we will continue to keep you informed as that data comes in. Thank you.
Thank you, Dr. Milton. Now I want to go to City Manager Jared Miller.
Thank you, Dave. Public safety calls for service for Amarillo Police, Fire, and Ambulance services are trending very close to historical averages. What this tells us is that we're moving around in similar numbers to previous years. I would just encourage everyone, especially on the heels of the mayor's comments, to be safe, to think about others when they're moving about, also to be aware of others' concerns and take that into account as you go shopping and things like that. Wear the mask, as the mayor and Dr. Milton have both suggested and recommended. But we're doing a good job of moving safely around our community. So as we expand services, as more and more things become available to us, and especially as we go through this holiday weekend, please be aware of your surroundings, the people around you, and take care of them, take care of yourself. AmarilloAlerts.com, we're still working to help people sign up for AmarilloAlerts.com. We recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. Just want to encourage people to continue to sign up for that. As of this morning, we have 6,326 people signed up. Go to AmarilloAlerts.com to sign up for that service. Also, the drive-through testing center is still open. If you feel sick and have symptoms you think might be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. As the mayor said, we are continuing to reopen the city, and this applies to the city organization as well and city facilities. This week, the city of Amarillo, we're beginning that process. We're on the tail end of our first week there. The utility billing department is accepting walk-ins at Amarillo City Hall. We're adhering to social distancing policies. Utility billing and vital statistics customers may also utilize curbside payment services. Customers wishing to utilize this service should enter the City Hall parking lots from Buchanan to leave payments in the drop box, and from Johnson Street to pay by credit card. While the curbside service is currently available, we're going to continue to evaluate that and continue to provide that service as long as demand warrants. The building safety department is also open to walk-in customers. We'll be following social distancing policies at the Sims Municipal Building. The public libraries have been open since May 11th, and they're also following social distancing policies. Warford Activity Center is open with social distancing in place to ensure the safety of all patrons. As earlier reported, the city canceled many of its seasonal activities, including outdoor pools and some recreation programs due to COVID-19 financial impacts. However, since the Warford Activity Center is not seasonal and is open throughout the year, the staffing and funding were already in place, allowing it to reopen as permitted by the state. The city's worked hard to reopen as many services as possible to the entire community, and we look forward to serving all of our citizens in every way possible. All other city departments will provide in-person availability for appointments or for meetings by appointment only. Please call individual departments to schedule an appointment. City staff will continue to be available for information by phone and by email and any other virtual tool that we have available. Finally, just wanted to give a little bit more information on the governor's new executive order GA-23. This order took effect on Monday, this past Monday. In addition to the essential services and religious services that are already functioning, the retail services, in-store non-critical services, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries that were already available beginning May 29th in Deaf, Smith, El Paso, Moore, Potter, and Randall counties. So for our entire health district, May 29th is going to see massage establishments able to open, along with tattoo studios, piercing studios, hair removal services, hair loss treatment, child care services. Dine-in restaurant services can expand to 50% of their total occupancy on May 29th as well. Bars and similar establishments can open at 25% of their total listed occupancy. Aquariums and natural caverns, similar facilities, excluding zoos, can open at 25%. Bowling alleys, bingo halls, simulcast racing, rodeos, and equestrian events all can open at 25% of their capacity. Drive-in concerts with spectators remaining in their vehicles. Amateur sporting events with a number of caveats. Also on May 29th, outdoor areas of zoos at 25% of their operating limits. And then on May 31st, it'll expand to include professional sports, youth camps, and youth sports programs. The professional sports, it should be noted, cannot have any spectators in attendance. Finally, people are charged with avoiding interactive amusement facilities. That includes video arcades, amusement parks, and water parks. People shall not visit nursing homes. Beginning June 1st, public schools can provide in-person classes for summer school. Private schools and institutions of higher learning, colleges, and things like that are encouraged to use the same standards and timelines as the public schools. Finally, the Environmental Health Department and Fire Marshal's Office will continue to monitor for compliance to the governor's executive order. That's all I have, Dave.
Thank you, Jared. This time, we now want to open it to questions from our media.
And we'll continue with the coronavirus coverage on air and online. And keep up with the latest, you can visit our website at myhighplains.com. For now, let's go and send it back to programming.
While also celebrating the holiday.
Well, it's what we've been saying, Jack. It's just individual responsibility and considering others. So getting together in smaller groups, because the fewer people you're around, the less likely you are to expose someone or be exposed. So if you decide to have a get-together, a small get-together is a good idea. An outdoor get-together is better than an indoor get-together. And then just social distancing. So as you set your chairs out, try to set those chairs 6 to 8 feet apart. Try not to sit directly across the table from someone like we would normally expect to at a barbecue or an outdoor picnic. But instead, just make those wise choices about how you arrange your time together. Be very careful about the food. Maybe not a buffet style, and just consider some of those things. And Casey and Dr. Milton may have some better specifics for you, but really just it's about our individual choices. Wear a mask, be 6 feet apart, don't go to large gatherings, and try to do things outdoors instead of indoors is a good summary, I think.
And then Mayor Nelson, I know we're waiting until the 29th to kind of fall in line with the rest of Texas, like along with El Paso. In that week's time, what is the governor and the state looking for?
They're watching numbers regarding our testing. What are our positive tests doing? Are they increasing? Are they plateauing? Most importantly, they're watching our hospital capacity. How many COVID patients do we have in our hospital? And what are our staffing levels? And thankfully, I'm so grateful. Those numbers are looking good for us. They're trending in the right direction. So I'm looking over at Dr. Milton. He's shaking his head. So visiting with the governor's office, those are the same things that we've been watching here for weeks. And I'm glad to have their support and to know that they're going to be responsive if we need them to send us extra supplies or to come with a testing surge task force like they did before.
Thank you, Mayor. This next question is for Casey. Has the nursing home testing been completed here? And I know you talked about it a little bit earlier. So has it been completed, or are we still looking to complete it?
We're still looking to complete it. I think we may have a couple of nursing homes still outstanding. The teams are working through those as fast as possible once they once they complete the nursing homes, then they'll move to assisted living and group homes. I don't believe we've started to receive the test results yet, but once we do, those will be incorporated into the report card.
All right, thank you, Casey. And this next question is for Dr. Milton. Those 6 patients that received that remdesivir, how are they responding to that medicine?
Generally speaking, they've tolerated the medicine well. The first patient that we administered the drug to several days ago actually has left the hospital, has been discharged. So I think overall we're happy with how things have gone.
I have no further questions for you guys. Thank you.
Thank you, Jack. Let's now go to Paula Albaran of Telemundo. How are you this morning? Sorry, I messed up your name. It's been a long day already. How are you this morning?
Don't worry. Good morning. Buenos dias.
Buenos dias.
My question today is about have you been thinking about opening like testing for people without symptoms, but maybe they have been in contact with a person who has tested positive?
So we do have our testing site available. I think with regard to testing people who have had contact, we want to make sure that we're testing at the right time and that we don't give people a false sense of security when they have a negative test. So it's best to test if you have symptoms, because if you test too early and you get a negative test and you get sick a couple of days later, then you want to make sure that you're testing at the right time and not giving someone a false sense of security with that negative test. And so we are there's lots of different opportunities for testing, both at Amarillo Public Health and Texas Tech drive-through. Walmart has testing available, and then the hospitals and private physicians. And so if someone needs a test, there's lots of ways to work through those testing criteria, but we want to make sure that people are tested at the right time.
Okay, perfect. And that was the only question that I had this morning. Thank you very much.
Thank you, Paula. This time we want to go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. So I guess my only question that I have, and I guess this could go through the whole panel, regarding the net active cases numbers from yesterday's report card with the minus 57 in Potter County and the minus 11 in Randall County. Can you tell me, give me a little bit of insight about what that means and what that means for our trends, I guess, going forward?
That was the first day that we really had a large number of net negative active cases. And so I think that as we move forward, we want to see more days of that, and we want to see days where that happens consecutively. And when that starts to happen consecutively and more often, then I think that's when we'll start to hopefully be on the back side of the peak. That will be the best case scenario there.
Mm-hmm.
Absolutely. And I guess for you, Mayor, I mean, how does that make you feel to have seen those numbers yesterday and potentially be on that side if this trend does continue?
Well, as far as the numbers are concerned, that trend is exactly what we hope to see. The other side of that coin is that I know, excuse me, we're not testing our whole city. So, if we had given 200,000 tests in the last week, and that number did that, I would sleep great tonight. So I want to give you a very transparent answer to tell you I do like watching our numbers go down. But I also know that we're just testing a very small portion of the people that live in our city. So I want people to continue to make wise individual choices about socially distancing, wearing a mask, washing their hands. Because if we just go by those numbers, they're the only numbers we have, and I'm grateful to have them, but we know right off the bat, they're not everyone. So they're just an estimate. And I know we still need to be vigilant here in the city about making wise choices in our own individual behavior.
Understood. That's the only question I have. Have a great weekend, you guys. Stay safe.
Thank you, David.
Thank you, David. This time we're going to go to Ariana Martinez of News Channel 10. Ariana, how are you?
I'm good. Good morning, everyone. This is probably for Dr. Milton. On Wednesday, the governor said Potter County hospitals will be receiving 7 cases of remdesivir. How many patients will that benefit, and which hospitals are getting them?
Your question was a little blurry. Was it about remdesivir that we received on Wednesday?
Yes. Sorry. Can you hear me better now?
Yeah.
All right. Let me repeat it.
Yeah.
On Wednesday, the governor said Potter County hospitals will get 7 cases of remdesivir. How many patients will that benefit, and which hospitals are getting it?
Yes, I believe both hospitals have received remdesivir, and I know at Northwest, the allotment that we received would be able to treat 20 patients for 10 days. So I really think there's an ample supply at present.
And then how many residents and staff have been tested at senior living facilities, and when can we expect results from those tests?
So there's around 14 nursing homes, and I'd have to get the numbers for assisted living facilities and the others. Each nursing home has a different number of patients, and so some are very small, some are larger. So again, I'll have to get the numbers for you. If the numbers questions, anything that you can get to Dave before the press conferences are helpful so that I can pull that data for you. We always want to have it. And so I'll have that data for you. I can get it for you next time, but we will start to have test results. Generally takes anywhere from 48 hours to probably around 4 to 5 days to get test results back.
Okay. And who is paying for senior testing, and what's the cost?
So generally the cost is anywhere from $50 to $100 a test, depending on the lab. And right now the state of Texas assured communities that the testing would be supported by the state of Texas.
Awesome. And do we expect a spike in new cases when the test results come back from JVS?
So anytime you test a large group of people, you understand that there will be positives. And so we do expect another group of positive test results after the testing. It's important to know that that happens anytime you test a large group of people. I think we've talked about the importance of wearing masks. Not going to work sick is also a very important detail. Good social distancing, good hand washing, all of those things are very important. And then anytime you test a large group of people, we do expect those test results to come, a number of those test results to come back positive, yes.
And do you have any thoughts on why the number of new cases are dropping?
So over time, we have, I think we're seeing fewer positives, fewer positive cases come in, and then as we have additional recoveries, then those the net active cases are on the negative side. It's a hard way to phrase that, but so we're glad to be seeing fewer positive cases right now in the coming through the drive-through clinic and other places. And then with larger numbers of recoveries, then the net active cases are showing in the negative. So I think over time we will see additional recoveries, and if we continue to have lower numbers of positives each day, then we will continue to see the net active cases in the negative, on the negative side of the line.
All right, thank you, Casey. And last questions, either for Mayor Nelson or Mr. Miller. Do we know how much debt the city is facing, and will closing the pools be enough to get the budget back on track?
Not opening the pools is in no way enough to cover all by itself the projected revenue reductions, but it is a component. We've been looking in every single general fund department to make reductions. both in capital projects, freezing positions, adjustments to operations. So it is one among many, many things that we're doing. It's also a way for us to be able to protect our bond rating and a variety of other things that go beyond just making sure that we have adequate resources to be able to continue operations without dipping into reserves and without increasing taxes associated with coronavirus response. So no, it's not enough to do it by itself. It is a piece of that puzzle.
And I'll say that just, managing the cash needs of the city are very important always, but very, very important right now in a time of uncertainty when we can't really rely on our typical predictions for what our revenue is going to be. And as Jared mentioned, we've recently been re-rated on our bonds, and we're so glad to report that we continue to have our high rating. But both bond companies did recognize that given the uncertainty of our revenue stream, they put a caution on it. And so they'll be looking at it even more closely next time. And, according to their predictions, we're at a higher risk to drop to a lower bond rating as a result of our revenue streams and the uncertainty of our cash position due to COVID. So it's very important for the long-term financial health of our city that we take as conservative a financial approach as we ever have. And we're balancing all of those needs. And as Jared mentioned, we can't tell you exactly what the shortfall is going to be. Maybe, Jared, $8 to $10 million at this time.
Right.
That's just an estimate.
That's just between now and at the end of September. So we will have to continue a very conservative posture going into the next fiscal year. And as we create the budget for the next year, while we're still not out of this coronavirus season, and still not knowing what's going to happen in the winter, as a number of pundits have projected, or doctors have projected, that we're going to have another bout of cases. Until we have a vaccine, and that vaccine can then be administered to everyone, it's going to still continue to be a challenge, and will have an impact on travel, on budgets, on sales tax revenues, and other things. As the mayor was also saying about bond ratings, our ability to maintain our bond rating and our ability to maintain a stable outlook with that bond rating, which is also an important component of our ability to issue debt when necessary and acquire and do major capital projects, is largely dependent upon our willingness to take aggressive steps, in our history of taking aggressive steps to manage reductions in revenue, so that we can always service that debt and continue to provide services to our citizens. So we've done that. We've demonstrated that right in the middle of coronavirus, right at the midst of a bond rating. We kept our high rating. We also kept a stable outlook. That's not because coronavirus is a stable period of time. It's because we've taken very aggressive and conservative steps to make sure and ensure that we're not going to have to dip into reserves, that we're not going to have to increase our tax rate while we go through this.
As a citizen, I'm disappointed. That summer programming, our family has used that for 20 years now and been blessed by it. And I know it's a big part of the quality of life that we're able to offer in our city. But I'm also grateful if we turn it around, instead of looking at the negative of finishing this year without some of the things we expect from our city budget to be able to provide. If instead we turn it and look at it as a positive, we are standing on the shoulders of giants here financially in the history of our city, because we have the lowest debt load of any large city in the state of Texas. And we have, I think, the second lowest property tax rate of any city our size in the state, or bigger in the size in the state of Texas. So financially, we are very strong to weather a storm just like this. And the bond rating company even recognized that. And that's due to years and years of strong city leadership, both on staff's part and city council leaders who term after term have valued having low debt and low property taxes, and maintaining our cash reserves so that we can be fiscally strong and weather a storm like this. And I'm grateful for that.
Perfect. Thank you guys, and have a great weekend.
Thank you.
Thank you, Ariana. That concludes our news conference for today. Once again, we do these every Monday, Wednesday, and Friday. Next Monday, in honor of Memorial Day, we will not be doing a news conference, just to let everybody know. I want to thank all of our panel members today who took the time out to provide this information. This is David Henry. I'm the Communications Manager for City of Amarillo. We'll see everybody next week on Wednesday. Thank you.
Bye.
Thank you.